Good day, everyone! For today, we will introduce to you carbon ion therapy. What is carbon ion therapy? The idea of administering radiotherapy employing heavy ions was first conceived during the 1940s by Dr. Robert Wilson. It was only put into action 30 years later in 1977 when clinical trials commenced in the Lawrence Berkeley Laboratory in Berkeley, California using helium and neon ions. While in 1984, the Heavy Ion Medical Accelerator in Chiba started constructions and started operations in 1994. Other facilities, such as the HIBMC and HIT, were built and constructed years later. So how does it work? When the carbon atom interacts with the atom of the target material, unstable isotopes such as carbon-10 and carbon-11 are produced. Subsequently, positrons are generated. When these particles are annihilated using electrons, 2 gamma rays are produced which are then responsible for killing the tumor or the cancer cell. Why use carbon ion therapy? One of the main features of heavy ion beams is its depth dose profile, where a sharp Bragg peak followed by a rapid dose falloff is observed at the end of the beam's range. In order to optimize the shape of the Bragg peak for clinical purposes, the Bragg peaks must be spread out, which will then allow the beam to cover most of the target volume. For the types of cancers that can be treated using carbon ions, carbon ion beams have been used to treat bone and soft tissue cancer, head and neck cancer, prostate and liver cancer, but the most prevalent ones are lung, pancreatic, and eye cancers. So how much would carbon ion therapy cost you? The cost of treatment in Japan does not depend on the site of the cancer or the frequency that will be used for treatment, and it would normally cost 4 million yen. However, in HIMAC, treatment would only cost a total of 3,140,000 yen. In Hyogo I&B Medical Center, however, patients can also avail of an insurance that would cover the fees for treatment of non-resectable bone and tissue carcinoma and pediatric tumors, although generally insurance would only cover the following procedures. That's it for carbon ion therapy. We hope you learned something from our video presentation.
Created using Powtoon.